we are going to be discussing about what holds in the future for diagnostics. Is genomic profiling the next wave? And with so much of wellness being spoken about, there is a natural significance to what we are going to be discussing now. So, right. I'll again start with Dr. Om Manchanda. You've seen the evolution of the diagnostic sector. The labs grew from a few to hundreds and all across the country. Now we are actually staring at the next level of genomic profiling. People are talking so much about, predictive tests, use of advanced diagnostics, and whether we can actually have some hold on predisposition of some of our underlying disease conditions. Your initial thoughts on exactly where do you think we are at the moment, and whether we will be seeing that kind of a wave catching up?
So first of all, thank you for having me here. My initial thoughts on the question that you asked is probably I'll draw upon my journey of last 2 decades in healthcare. I think I've seen a phase where healthcare was primarily driven by service level innovations. So, let's take example of diagnostics. When I joined Dr. Lal, close to 80-90% of our business was actually people walking into our labs. So where testing, collection and delivery of report, everything was happening in one place. And with time, it all started going in different direction thanks to technology. The collection center network came in, then home collection came in. Now all this, you see everything happens on mobile, and you actually don't even go to the lab at all. So I've seen that transformation, and a lot of these new age companies are tech-driven stuff. So that's the one dimension of change that I have seen over the last 15, 20 years. I think the other biggest change, which probably we are at the cusp of that, or maybe we already are into it, is where the public awareness or patient awareness about science has gone up many folds. And there have been many triggers to this. One trigger has been, we all get to see the sudden deaths that are happening in our society. And then COVID came in, and we suddenly found comorbidity is not a great thing to have because you're more vulnerable. So I've seen this whole transformation from healthcare being very prescriptive to preventive, now to predictive. I think that's a dimension on which we are. I think many years back, I still remember a hoarding which I saw, I think in Delhi, maybe 10, 15 years. Only time we see a cardiologist when you have a heart attack. So that's not true anymore. Okay, we do see cardiologists well before that event takes place. So I think coming back to your point of predictive side of it, I think a lot of preventive health checkups, I think it's a way of life, may not be across the POPs data, but I think at the top end, probably all of us go through that. There's a lot of knowledge which is building up about predictability, because we all want to know what are the risk factors we are carrying with us because of our genes. And I think science is pretty advanced now, and probably we'll get to hear from MedGenome as well and Dr. Mahajan to talk about what are the things that are really happening for us to know what are the risk factors that we all carry. So personally, I feel the next phase of growth is going actually from preventive to predictive. These are my initial thoughts, yeah.
To you, Dr. Mahajan, imaging itself has seen a revolution. And how do you see it combining with genomics and next generation sequencing? Do you see there are lines converging?
That's a very interesting question. And actually 6 years ago in our radiology center, we started next-gen sequencing. And at that time, it seemed that it was quite unusual. In fact, globally, we were told we are the first radiology setup to have NGS along with it. And it so happened that the machines were about 4 or 5 meters apart. It just happened by chance. So, and also, our research division, and this is 2016 when we coined this name, it was called Caring. Caring is our Center for Advanced Research in Imaging, Neurosciences, and Genomics. So I think not only now, but the world already knew that these diagnostic modalities or departments which are working in silos have to actually come together, because ultimately what does a patient who's suffering want to know? What does his physician want to know? They want one diagnosis. They don't want multiple, points or data points, and then, trying to guess what is where. So I think we've entered now very definitely the era of integrated diagnostics and genomics, both with its predictive part, which is for wellness, as the Om has just spoken, and its precision part, which is for treatment, mostly cancer, but then it's entering, the neuro field, it's entering cardiology, even diabetes. So they go hand in hand, and ultimately I see that most diagnostics as we go forward will attempt to be integrated and not work in silos.
So yeah, so taking it forward from Dr. Mahajan, Dr. Dang, uh, so the one-size-fits-all concept is kind of fading away. Do you think it's the age of more precision, more personalized care? Just give us a roadmap of what do you see happening in the next maybe 5 to 10 years?
So thank you, Vikas, for that question, and thank you, ET, for having me here today. So, of course, like Om sir and Harsh sir spoke about precision diagnostics and genomics and tailored therapeutics, the session before us was about AI wearables and whatnot. I mean, that is definitely here, that is definitely the future. But what I also think about every day is that, just a quick anecdote, there was these two youngsters who actually post the pandemic thought we'll get a checkup done in any of the labs. They had seen a lot of those 999 advertisements. They walk into a lab, not from the medical fraternity, but they end up picking a package based on two basic things. That's their basic medical knowledge. Ki, oh, my grandmom had some diabetes and my father had a cholesterol key problem. And of course, secondly, is their budget. That is, if it's 1,000, 2,000 or 4,000 rupees, based on that, they pick a package. So that is something I think about every day, because that is a cookie cutter kind of an approach. That's like painting with a very broad brush, not by actually a very thin brush where you can craft a painting, right? So the exact way where a country like ours can actually embrace a precision diagnostics is by having these wellness packages that are not one size fits all. It's not a silver and a gold and a platinum, but it's where each and every person actually picks the package and the test that is based on three factors. That is their medical history, that is their previous reports. Second is the health goal. I mean, everyone in this room probably has a particular health goal. Someone just wants to live longer, someone might have a chronic ailment, someone might have fitness and weight gain as an issue, someone might have sexual health, someone might have sleep and mood. So what we came up with a couple of years back was a free of cost website that helps anyone log in, put in their health goal. It analyzes their previous reports, of course, if you've tested with us, but otherwise also you can feel free to use it wherever you've tested. And within a few minutes, based on these few parameters, it curates a personalized package that is just for you. And what's the most important and the most fun thing in this, Vikas, is that every test that is recommended for you actually has a peer-reviewed publication that actually gives you the chance to read that why is this test suggested for me. So I think this reduces that redundancy of tests. It also helps people do the right test at the right time. And I think the broad narrative of diagnostics also in the country has now become that, oh, they have these packages and these are bundled tests and 50% discount and whatnot. But I think 90% discount and whatnot. And I think going ahead, it is in Hindi, the slogan should be, अगर आप कोई टेस्ट कर रहे हैं, so अपने लिए correct test choose करिए. So I think that's what we managed to achieve with this. The website is called discover.drdangs.com. So anyone with a few minutes and wants to have some fun on their phone, do log in and give me a feedback. Thank you.
Vikas, if I may just,
Sure.
I mean, I agree entirely.
Yeah.
You know, this is the era
Yeah.
of personalized health checks.
Right.
You know, someone walking in at 30 years of age, someone walking in at 50, and someone walking in at 70 years of age.
Yes.
If you think I'm very rich and so I'll get the platinum package, you may just miss the disease. So many times we hear that so-and-so went last week, got a health check done, was fine, and today he had a heart attack and died.
Oh my God.
Everyone would have heard of these episodes. So
Right.
it's what has been said is very, very important.
Right.
So, sir, just a quick, some data that we gathered was that we've done 7,000 of these checks in the past 1.5, 2 years. Usme se we looked at the 30 to 35 age group. We have 9 health goals. Usme there was a distribution of the most common package that was suggested by Discover was just 20%. So that means even 30 to 35, there was like a curation of different tests altogether.
So you already touched upon the next level of questions that I was going to ask. Dr. Saktivel, Medgenome has been there for, about 10 years or more, and you've seen the global landscape actually shaping among the most early stage companies that saw this huge opportunity coming. So I'll not get into the past now, but how do you see these issues emerging where there are very clear signals of maybe inaccurate readings? Again, I'll also go to the example of US. 23andMe went belly up despite massive backing of funding, and I think they got saved by Regeneron. They have acquired them now. But that journey has not been, free of glitches. How do you see that coming? Because you are among the companies which is seen as the next promising organization.
Yeah. So, as you said, 10 years of journey in Medgenome, it started as a diagnostics. So diagnostic leading to prevention, right? So you identify the mutation and then you see how the other siblings will be affected, the next generation is going to be affected or not. You do a prenatal, so there was a prevention. But we are now moving into predictive, right? So predictive is very critical because there are two things here. At predictive, to see whether a person is eligible for a treatment or not. So that is the most common genomic test now, right? Especially in the cancers, to see whether a person is really eligible for a particular drug. And every drug has its own mutation or change in the genome, which can be tested. Preventive or more predictive now is the wellness tests, right? So wellness tests have their own, small issues. The main issue why these companies were going down is because there were not proper, databases. There were no proper evidences and no proper guidelines, right? So what is very critical when we are going into predictive genomic testing is proper guidelines and proper awareness. Guidelines to tell that which are the tests which need to be given, right? We can give currently Medgenome can give a polygenic risk score for almost 8 to 10 disorders, all well validated. And 2 or 3 of them we have published already, like Parkinson's disease, like coronary artery disease, we have already published. Along with some phenotypic data, we can get a good more than 90%
May I request
predictive value.
audience to concentrate. We have just 10 minutes to go because let's listen what he's saying.
So more
Thank
than
you.
90% predictive value for coronary artery disease. So all these are possible, but how they can be taken by the population, that is very critical. For that, guidelines are very critical.
Right.
Guidelines as to how the test has to be given,
Right.
what are the validations that has to be given, and what are the pre and post genetic counseling that has to be given. If these guidelines are set, yes, there is a possibility that these can be a population-based test, these can be given as a direct-to-consumer test. But till then, we need to be very careful.
Right. Dr. Mahajan, you're always very alert about the policies side. Have you heard any signals coming from the government on, if there are any guidelines on genomic profiling, genetic testing, on how predictive diagnostics can be done? Any moves that you can make us aware of?
See, the government does have centers where IGIB here in Delhi itself is a center of excellence for genomics. But on the policy front, it will be asking for too much from the government for such expensive technology and tests which still are very, very expensive, even though we are probably, 1/4 of what is charged abroad. But the government is involved. But I don't see any real policy coming. But suppose, and this is a question, which I ask often, suppose we were to get a whole genome sequence done, even for those that are actionable genes, done for 100 rupees.
Yeah.
Let's just imagine a scenario. If we were to actually do it for our entire population, and out of 1.4 billion population, pick up that 100 million or 200 million who are at increased risk for cancer, and then actually, what is the idea of predictive medicine? That then you screen them in a very, good manner, and so that you're able to pick up disease early. Stage 1, stage 2 cancer leads nearly always to a cure. Stage 3, stage 4, you're struggling, and you're talking in 5-year survivals. And also the thing is, if you are able to pick up early, not only are the results good, but it's much, much cheaper.
Right.
So that's why, I say that it's very important, and MedGenome has done something phenomenal, that they've developed these tests here. Of course, all the money that they're making is in the US.
Right.
Here in India, they still lose money.
Right.
So somewhere we've got to find a middle ground.
Right.
So that we can make those cheaper. Maybe you're making money here also. Sorry.
Yeah, I want to correct that. Actually, we are making money here, but
So-
not in US.
Yes, before you continue with the
Don't
conversation.
say that to the government.
Okay, I have a request to everybody seated at the back. There's a lot of talking happening, and we have some senior leadership onto the stage. And this is what they're talking is especially for you. Would request you all to please take the conversations outside in case if it's that important. But over to you, sir.
No, so getting into the next level of discussions, here we've spoken about use of genetic tests, DNA sequencing on two poles. One is on predictive medicine for oncology, where you actually don't bombard patients with unnecessary chemo drugs and go very, very clear on the biomarkers for which it works. And it's already in vogue. I mean, people are using it in a big way. And on the other side of the spectrum, you have this wellness craze. So, the color of hair or the color of eyes, DNA test kits, which 23andMe was also selling. And to find about the ancestry, and a lot of things actually got revealed at that time. With all of these potential opportunities, there is also a question of data breaches, which again actually got hammered. 23andMe faced a lot of flack because of that. So before we get into the policy issues, I mean, how does one really get around these very, very complicated issues of data? How do you preserve data? How do you ensure that the data security is not compromised?
Yeah. See, This is actually a very critical thing. There is no, again, I'm coming down to the guidelines. There is no specific guidelines in India. However, there is one, I would say, a news which is not really published is that data from India should not go out, either as a direct data or through cloud. Okay. So what we ensure from our side is that we follow some guidelines. So we go with the GDPR guidelines, which is a European guidelines, which is quite a strict guidelines. We try to follow some guidelines so that we want to place ourselves in the safer side. And the data is so well protected that even we don't even host the data in a cloud outside the country. So as of now, with the existing guidelines, with what we hear from, what we get from the ICMR or from the medical health system. So based on that, we try to keep us within a framework where the data doesn't go out, data is not shared unnecessarily to anyone other than the patient or the clinician. Even if another clinician who's seeing the patient wants the data from us, we expect a consent from the patient or the original clinician. So we try to keep some framework wherein we try to ensure that data doesn't go to the wrong hands.
Would you be also following the same system, sir? Dr. Mahajan?
Yeah. See, the data belongs to the patient.
Right.
And unless the patient has consented, that is de-identified. It has, whenever shared, it has to be de-identified. But without consent is why 23andMe doesn't exist today. And so if someone thinks I will do scans for free or do, health checks for free or do genome sequencing for free, so that I'm able to use that data, you have to first inform the patient, take a written consent, and only then can you use it.
Right. So I'm not sure whether I have the full information about this, but $256 million that Regeneron agreed to pay to 23andMe to buy that. I think it was also mentioned very clearly that they'll get access to millions of patients' data. So, I mean, as you said, there is a big gray area there. Okay, so I'll go to Dr. Manchanda now. So with that kind of opportunity, do you think, it will actually become very prevalent? You think people will lap it up? It's really the next wave, or do you think genomic testing will take more time to get accepted? Pricing wise, Dr. Mahajan, I think about 10-15 years when the genome sequencing was happening, it was a multiple level higher. 1 million, exactly. And took a long time. And then we saw the next generation sequencing coming.
So I think it will probably, in my view, it's going to be a slow process. It's a highly evolving part of medicine. It is still not a very exact science. Even if you see a genomic reports, nobody will say with surety this is it. So there's always a probability attached to all that stuff. So my sense is first level of adoption of this is going to first amongst the medical fraternity, because it has to be an assistant or a tool to other information which is available. So in isolation, my sense is you can't really make out everything, but this is an added input to whatever knowledge one has. So we have seen on precision medicine, especially in the cancer line of therapy, it's quite popular. But I think it will probably move in parts, slowly, but it will definitely has its own journey, which is not going to be like a hockey stick, but it will probably be a slow journey.
Right. Dr. Mahajan, you would agree with that?
I tend to agree. See, on the precision part, which is the treatment part, I think it's going to grow very fast. Because it is not only in cancer, today you're finding more and more genetic bases for so many diseases,
Absolutely.
be it kidney, be it liver, be it brain, cardiac. So there it's going to move very fast. But on the predictive side, I think I agree entirely with Om that it will be a slow process because of also human nature. If we were to take a poll of how many people here want to know whether they are at higher risk for a certain disease when they are absolutely fine, unless there is cancer in the family,
Exactly.
Very few. So there are those who say, I want to know, and most who say, देखा जाएगा जब होगा तो तब देखेंगे.
Right.
So predictive will be slow.
Right. I think Pratibha and I were speaking about the Angelina Jolie effect. So,
Yeah, I think she did a great service
Yeah.
to
Absolutely.
mankind
Sure.
by coming out
Absolutely.
and telling that she had a bilateral mastectomy.
Right.
And because of BRCA 1 and 2 positivity,
Became big,
and she was at 80% high risk
Absolutely.
of breast cancer and
Right.
ovarian cancer.
Right.
So it's a personal choice
Right.
at the end of the day.
Right. Dr. Arjun Dan, beyond cancer, do you think there are opportunities to explore in places like AMR? Do you think that's something that is actually hitting our country in a big way, in a very stealth way? We don't get to see much, but I have been hearing a lot of that. So, your take.
So again, going back to the basics, very relevant, and I'm glad, Vikas, you're bringing this topic up, because I think this is the silent pandemic, and antimicrobial resistance is a real problem. And of course, the problem is so huge that if it happens, if and when it happens, it'll push us back into the pre-antibiotic era. So actually, we actually encountered the same issue where we were having dozens of these people who were presenting with issues and infections such as prostatitis, recurrent UTIs, recurrent respiratory infections, even non-healing wounds, for example. And for that, actually, we introduced something that is very precise and, of course, in a lot of ways better than antibiotic therapy also, and that is called as bacteriophage therapy. Now, bacteriophages, for everyone to understand, is nothing but a cocktail of viruses. जैसे हमने सुना होगा कि गंगा इसलिए शुद्ध है क्योंकि उसमें phages होते हैं. So that is where this comes from. And then we did a tech transfer from this university in Georgia that has done a lot of work in bacteriophage therapy. And we became the first ones and the only ones to provide this thing called bacteriophage sensitivity testing. So like in a urine culture, you check which antibiotics are working on you. In bacteriophage sensitivity testing, we check which bacteriophages will work for you. So of course that opened the doors to much more precise treatment for infections, and especially a need of the hour considering that AMR is looming. I mean, genomics also, from tuberculosis to various other infections, plays a huge role. And I think everyone keeps talking about it. But I think it's just time to take 2 steps back and look at the entire wall, like the map of India is, and then actually picture how simple things and simple changes can make a huge impact.
So, when you spoke about the Ganga pollution, I remember about a company called Gangagen Biotechnologies, which have been working extensively for the last 20-25 years on the good bacteria. And it's been a very phenomenal success for them. So, right. So, Dr. Shaktivi, this is the last one. How excited are you about the future? What are the trends that you see coming ahead?
Yeah. See, we have seen that the awareness of genomics growing phenomenally over the last 10 years. But still, we are still scratching the surface as far as India is concerned. The diagnostics has gone only to the urban cities and to maybe tier 2 cities. There's still a long way to go. One good thing which has happened is that the affordability and the availability is there now, right? So, and even before we are going into predictive genomics, there is a lot more we have to do in terms of preventive genomics and in terms of diagnostics, right? Which will diagnostic leading to preventive genomics. So if we are able to achieve these two, okay, especially simple tests like NIPT, which can prevent a lot of babies born without a Down syndrome or Turner syndrome. How many of them are doing now? Very, very, very few. I would say less than 1%. Okay. So there is a lot which we can achieve as part of as far as preventive diagnosis is concerned. I think if we are able to achieve that, predictive diagnosis is not very far away. All predictive diagnosis requires is guidelines. If we are able to get the guidelines done, as for India, why do we have to depend on the West for any sort of guidelines, right? There should be India-centric guidelines, and the medical fraternity should join together to have India-centric guidelines. And if we do that, the future is really bright.
Amazing. Completely agree with you on that. And it's a very positive note to end the session and also the day. This was the last panel. So thank you so much. I think this was a very enriching discussion for me.